Hello everyone, welcome back to my channel. This is actually a continuation of the dissection series. So those who are watching this for the first time, I would like all of you to watch the previous sessions which I have done for the dissection. That is the region, the pectoral region, the region of axilla, and also the brachial plexus in a nutshell. Now we are moving with the dissection of the back, which is the next topic according to Cunningham. So the dissection of back, when we do the dissection in the dissection hall, we mainly focus on the muscles at the back which are lying in the midline region. When we talk about the dissection of the back, there are mainly two group of muscles. One which connects the vertebra to the upper limb, and the next set which connects the scapula with the humerus. So these are the two sets of muscles which altogether comes in the back. But when we do the dissection in the dissection hall, we are mainly concentrating on the midline structures coming in the thoracic region. The other set, the scapulohumeral, is actually dealt as a separate topic where we will be exploring the muscles, the structures within the muscles and all, like the quadrangular spaces, triangular spaces, the muscular spaces and all in detail. So now we will focus on the muscles which are more or less lying closer to the midline, and these muscles actually connect the vertebra with the upper limb, and so we will see the muscles one by one. So there are mainly two sets of muscles in the back. The superficial layer, it mainly consists of trapezius and latissimus dorsi. Trapezius in the upper part and latissimus dorsi in the lower part. Trapezius, as we all know, when we consider the trapezius on both sides together, it is in the form of a trapezius. But when we consider it on one side alone, it is in the form of a triangle. Now, when we talk about its origin, we know it starts from the superior nuchal line up to the T12 vertebrae. So that is the midline contribution, and it is getting inserted to the clavicle, the posterior border lateral one-third, as well as the scapula along the acromion and the spine of scapula. So that is how the trapezius is getting inserted. Now, when we talk about the nerve supply, we have the spinal accessory nerve, which is supplying the trapezius. Lower down we have the latissimus dorsi, which is actually a muscle which spans over a wide region. That is, it starts from the lower 6 vertebrae, then it takes its origin from the iliac crest, external oblique abdominis, and finally it is getting inserted into the floor of the humerus in the intertubercular sulcus. So that is the code we use. Lady between two majors. So the lady is latissimus dorsi between the two majors, that is pectoralis major and the teres major. So that is how we get the latissimus dorsi. So latissimus dorsi was actually a muscle of the upper limb, but now since majority of the portion is seen in the trunk, it is considered as a trunk muscle as well. Now talking about the nerve supply of latissimus dorsi, it is the thoracodorsal nerve which we have already seen when we dissected out the brachial plexus from the anterior portion. From the front region, we have already seen the nerve passing and supplying the latissimus dorsi. Now, once we reflect the trapezius and the latissimus dorsi, we are not exposing much because we are more or less concentrating on the thoracic region. So it's better just to reflect the trapezius at this point. Then we can see deeper to the trapezius, three muscles: levator scapulae, rhomboids minor and rhomboids major. This is the order in which we will get. And all these are attached to the medial border of scapula. Levator scapulae in the upper part, and rhomboids minor to the root of the spine of scapula, and along the rest of the border you have the rhomboids major, and all these three muscles are supplied by dorsal scapular nerve. So when we reflect the trapezius, you will be seeing the superficial branch of transverse cervical artery along with the spinal accessory nerve, and deeper to that you will be seeing the nerves supplying the levator scapulae, rhomboids minor and major, that is a dorsal scapular nerve running along with a deep branch of transverse cervical artery. Now, two triangles you should bear in mind when you discuss the muscles of the back. One is the triangle of auscultation, which is in the upper part. That is actually formed between the medial border of scapula on one side, lateral border of trapezius on the other side, and the base is actually formed by the latissimus dorsi. And here you get the 6th and 7th ribs and the 6th intercostal space. And this region actually corresponds to the upper apical segment of the lower lobe of the lung. So you can easily auscultate this region through the triangle of auscultation. Now the lumbar triangle of Petit is seen at the lower part. One border is formed by the iliac crest, Then laterally you have the posterior border of external oblique, and medially you have the lateral border of latissimus dorsi. So latissimus dorsi, external oblique abdominis, and you have the iliac crest. And the floor is actually formed by internal oblique, and this region is actually said to be a weaker region through which you can get the lumbar herniation. So these are the muscles and the applied aspects of the region of back. And the scapulohumeral muscles like the teres major, teres minor, then you have the subscapularis, supraspinatus, infraspinatus, deltoid. All these muscles will be discussed in the next session when we discuss the quadrangular, triangular spaces and all. So thank you. Hope now you have a small idea about the muscles of the back. Thanks for watching.